Tired of dealing with annoying flies, fruit flies, and gnats in your home? The Zevo Flying Insect Trap is your ultimate solution. Don't wait. Check out the link in the video description now to get your Zevo Flying Insect Trap on Amazon and enjoy a bug-free home today.
The World Health Organization declared an ultra-deadly strain of monkeypox a global public health emergency for the second time in 2 years. Officials said Wednesday that an outbreak of the strain in the Democratic Republic of the Congo is a public health emergency of international concern, the WHO's highest level of alert. The hope is to speed up research and accumulate more funding and public health measures to contain the disease, which has already spread to several of the DRC's neighboring countries. The announcement comes 1 week after the WHO expressed concerns about the virus having the potential for further international spread within and outside of Africa. No cases have been reported in the U.S. in the latest outbreak, but doctors have been urged to watch out for symptoms like skin rashes and lesions. Director General of the WHO Dr. Tedros Adhanom Ghebreyesus said Wednesday, "It's clear that a coordinated international response is essential to stop these outbreaks and save lives." The DRC is home to a densely packed population that frequently travels and moves across borders, raising the risk the monkeypox strain, which is spread through physical contact, would eventually spread beyond the country. More than 17,000 suspected cases of monkeypox, now called mpox, and 517 deaths have been reported on the African continent this year alone, according to the Africa Centers for Disease Control and Prevention. This is a 160% surge compared to the same period last year. A total of 13 countries have reported cases. And in the past month, at least 15 pox cases have been reported in 4 other countries bordering the DRC, countries that have not experienced the virus before. They include Burundi, Kenya, Rwanda, and Uganda. Pox caused an international epidemic in 2022 when it spread to more than 100 countries and killed hundreds of people, including 58 Americans. That outbreak was caused by the more mild Clade 2 strain, which is rarely fatal. But for more than a year, the DRC has been struggling to contain a deadlier version of the virus known as Clade 1A, which kills up to 10% of those infected. The new mutated strain, dubbed Clade 1B, appears to be just as deadly. In a report released in May, CDC officials called this DRC's largest surge of pox cases ever recorded. Clade 1B has been confirmed in Kenya, Rwanda, and Uganda, and the virus detected in Burundi is still being analyzed. Dr. Josie Golding, head of epidemics and epidemiology at Infectious Disease Organization Wellcome in the UK, said, "Epidemics pose a threat to health and health equity globally. The current surge of cases in Africa demonstrates the ongoing and growing threat of mpox. We should not wait for diseases to escalate and cross borders before acting. Effective outbreak control requires sustained, coordinated efforts worldwide, from local and national governments, and public and private industry to funders, regulators, and NGOs. 2 vaccines have been backed by the WHO to prevent pox infection. The organization recommends a vaccine within 4 days of contact with someone who has the virus or within up to 14 days if there are no symptoms. Healthcare workers and men who have sex with men are advised to receive a vaccine even if they have had no pox exposure. Symptoms of mpox include a rash, skin lesions, fever, headache, muscle aches, back pain, and swollen lymph nodes. It is spread through physical contact, such as kissing or sex, animals when cooking them, contaminated materials, and pregnant women who can spread it to a fetus. There is no direct cure for mpox, but doctors aim to treat its symptoms, including clearing up the rash and managing pain.